Neurologic and neuromuscular drugs. Nervous system includes central nervous system and peripheral nervous system, CNS brain and spinal cord. PNS somatic and automatic nervous systems. Neuromuscular system muscles of body, plus the nerves that supply these muscles. Drugs include skeletal muscle relaxants, neuromuscular blocking drugs, anti-Parkinsonian drugs, anticonvulsant drugs, and anti-migraine drugs. Skeletal muscle relaxants relieve MSK pain, spasms, spasticity, stiff movement, multiple sclerosis, cerebral palsy, stroke. Centrally acting agents treat acute muscle spasms due to anxiety, inflammation, pain, and trauma. Also treat spasticity due to MS and cerebral palsy. MOA specifics are unknown, but the drugs are CNS depressants. Skeletal relaxation is an effect from the sedative effects of decreasing CNS stimulation. Side effects: physical dependence, cessation can lead to withdrawal symptoms, dizziness, drowsiness, bradycardia. Direct acting agents. Dantrolene sodium is the only drug in this category. Used for spasticity in cerebral palsy, MS, spinal cord injury, and stroke. MOA acts directly on muscle, interferes with calcium release weakens force of contractions. Side effects: drowsiness, dizziness, muscle weakness. Others. Baclofen. Used for spasticity in MS and spinal cord injury. MOA specifics are unknown, reduces nerve impulses in spinal cord to skeletal muscles decreases severity of muscle spasms. Side effects: drowsiness, fatigue, muscle weakness.
Neuromuscular blocking drugs disrupt transmission of nerve impulse at motor end plate relaxation of skeletal muscles. Used to relax skeletal muscles during surgery, reduce muscle spasms in seizures, and manage patients fighting ventilator in ICU. Non-depolarizing blocking drugs. MOA drug competes with ACH at cholinergic receptor site blocks ACH action prevents muscle from contracting. Effect can be counteracted by anticholinesterase. Used for muscle relaxation to ease ET2, muscle relaxation to help realignment of dislocated bones, muscle relaxation for fighting mechanical ventilation, and prevent muscle relaxation. Side effects: apnea, hypotension, bronchospasm, excessive salivation. Neuromuscular blocking drugs do not affect consciousness or pain. Anesthesia plus analgesia should always be used when neuromuscular blocking agents are used. Depolarizing blocking drugs. Succinylcholine is only drug in this category. MOA acts like acetylcholine but does not get inactivated by cholinesterase. Once administered, it attaches to receptor sites on skeletal muscles prevents repolarization of motor end plate muscle paralysis. Drug of choice for short-term relaxation during intubation. Side effects: primary side effect is hypotension plus prolonged apnea. Anticonvulsant drugs. Seizure disturbed electrical activity in brain. Partial, focal part of brain is affected. Simple, experience some elements of aura, some twitching, usually in one limb. Complex, experience some elements of aura. Often consist of repeated movements, some altered consciousness, autonomic, sensory and motor signs, confusion after seizure. Generalized involves all of brain. Absence, petit mal, stirring plus transient loss of responsiveness and then retrograde amnesia, not remembering what happened. Atonic, short episodes where patient suddenly falls. Tonic-clonic, grand mal, may experience some element of aura, then tonic phase, muscle contraction, then clonic phase, repeated contraction and relaxation, usually followed by deep sleep, postictal state. Also has retrograde amnesia. Special cases. Febrile seizures, tonic-clonic seizure related to rapid rise in body temperature. Myoclonic seizures, large jerky body movements due to uncontrollable skeletal muscle contraction. Status epilepticus, seizure is repeated or prolonged, life-threatening due to risk of hypoxia. Medications for seizures will decrease neuron excitability. Observe and record intensity, duration, and location of seizure activity.
Barbiturates. For generalized tonic-clonic seizures. MOA stimulates gamma-aminobutyric acid neurotransmitter, an inhibitory neurotransmitter, which then inhibits brain activity. This is what causes the drowsy, calming effects. Side effects: drowsiness, tolerance, dependence, respiratory depression, GI effects, contraindication, liver or kidney disease. Medications are not to be stopped abruptly as this can cause seizure activity. Benzodiazepines. For absence and myoclonic seizures. MOA, side effects, and contraindications are same as above. For injection, administer slowly to avoid bradycardia. If there is an overdose on benzodiazepines give flumazenol, romazicon. Hydantoins, phenytoin. For partial and tonic-clonic seizures. MOA, block Na plus influx neurons are kept in absolute refractory for a longer time less frequent action potentials. Side effects: dependence, respiratory depression, gingivitis, ataxia, dizziness, lethargy, alter vitamin K metabolism, dysrhythmias, nystagmus. Frequent blood work is needed to monitor drug levels.
Phenytoin-like drugs. For absence, tonic-clonic seizures, bipolar, and migraines. MOA same as above. Side effects: increased bleeding times, photosensitivity, hepatotoxic, pancreatitis. Succinimides. For absence seizures. MOA prevents CA+2 entry through specialized T-type channels in thalamus decreases neuron excitability. Side effects: anorexia, blood dyscrasia. Anti-Parkinsonian drugs. Parkinson's disease neurologic disorder characterized by muscle rigidity, akinesia, loss of voluntary movement, tremors at rest, change in posture, balance. The above can also be known as extrapyramidal symptoms: restlessness, rigidity, tremors, pill rolling, mask-like face, shuffling gait, muscle spasms, twisting motions, difficulty speaking, swallowing, loss of balance control. Chemical imbalance with Parkinson's: too little dopamine, too much ACH. Too much ACH increased cholinergic activity creates the involuntary movements. Tremors goal of anti-Parkinson's medication symptom relief, and improve mobility by either inhibiting ACH or enhancing dopamine.
Anticholinergic drugs. Also known as parasympathetic drugs inhibit action of SCH in parasympathetic nervous system. MOA, inhibition of SCH at receptor sites reduction of tremors. This category of drug reduces the tremors plus drooling but has minimal effect on the bradykinesia, rigidity, and balance abnormalities. Side effects: anticholinergic effects confusion, drowsiness, urine retention, blood vision, dry mouth, secretions, increased HR. Contraindicated in narrow-angle glaucoma, BPH, GI obstructions, myasthenia gravis, dysrhythmias. If discontinued abruptly, Parkinsonism can be intensified. Dopaminergic drugs. These drugs increase effects of dopamine. MOA, increase in neurotransmission of dopamine. Side effects: too much dopamine uncontrolled plus involuntary movements, muscle twitching, spasmodic winking, orthostatic hypotension. Interact with TCAs, MAOIs, antihypertensives, antipsychotics, anticonvulsants, antacids. Contraindicated in cardiac, kidney, and liver disease, in narrow-angle glaucoma, history of seizures.
Anti-migraine drugs. Migraine unilateral headache, pain, pounding, pulsating, throbbing, sometimes preceded by aura other light, sound sensitivity, migraine is due to vasodilation or due to release of vasoactive plus inflammatory substances from nerves in trigeminal system. Treatment equal abort migraine after it has started or prevent one from starting. Abortive medications equal analgesics, NSAIDs, ergotamine, serotonin agonists. Preventative medications equal beta blockers, TCAs, valproic acid, and NSAIDs. Serotonin agonists. Treatment for moderate to severe migraines. MOA. Serotonin agonist equal cause constriction plus reduction of inflammation in trigeminal nerve equal provides relief. Side effects: tingling, flushing, dizziness, weakness, somnolence, chest pain, dry mouth. Contraindicated: ischemic heart disease, stroke, CAD. Ergotamine. For abortion of migraine. MOA. Blocks inflammation plus partially acts as serotonin agonist. Side effects: numbness, tingling, muscle pain, weakness. Analgesics. Non-opioid analgesics, antipyretics, NSAIDs. Control pain, control fever, and produce anti-inflammatory effects. No physical dependence. Salicylates. Used for pain control and reduction of fever plus inflammation. Most common salicylate equal aspirin. MOA. Inhibits synthesis of prostaglandin, a chemical mediator that sensitizes nerves to pain, equal relief of pain. Stimulation of hypothalamus equal blood vessel dilation equal reduction of fever plus increased sweating, promotes cooling. Aspirin MOA also includes interference of thromboxane A2 production, necessary for platelet aggregation, equal inhibition of platelet aggregation equal use to enhance blood flow during myocardial infarction. Side effects: bleeding tendency, dizziness, confusion, hearing loss if drug is taken for prolonged time, and risk of Reye's syndrome if given to children with chickenpox, flu-like symptoms. Acetaminophen. MOA. Reduces pain plus fever but does not affect inflammation or platelet function. Inhibits prostaglandin synthesis to reduce pain and acts on hypothalamus to reduce heat. Side effects: liver toxicity. Non-selective NSAIDs. Normally, inflammatory disorder produces, releases prostaglandins equal causes pain. MOA. Inhibits prostaglandin synthesis by blocking COX-1 and COX-2 equal decreased inflammation plus analgesic effect. COX-1 prostaglandins in stomach lining, therefore produces GI side effects. COX-2 prostaglandins that mediate inflammatory process. Side effects: abdo pain plus bleeding, diarrhea, ulcers, liver toxicity, drowsiness, confusion, tinnitus, bladder infection. Contraindicated for perioperative pain for CABG. Take the drug with meals or milk to reduce GI side effects. Selective NSAIDs. MOA. Selectively blocks COX-2 equal decreases prostaglandin synthesis equals decreases pain plus inflammation. Side effects: fluid retention, edema, dizziness, headache, GI ulcers, less than non-selective NSAIDs.
Opioid agonist plus antagonist. Opioid equal drug that imitates natural narcotic. Opioid agonist equal relieve or decrease pain. Opioid antagonist equal not pain medication, but instead can reverse the side effects, CNS or respiratory depression, produced by opioid agonist. Opioid agonist. MOA. Drug binds to opioid receptor in PNS and CNS equal produces effects of analgesia plus cough suppression. Side effects: decreased flushing, hypotension, pupil constriction. Risk of opioid addiction, abuse, and misuse must be assessed, can lead to overdose and death. Opioid antagonist. MOA. Attached to opioid receptors but do not stimulate them equal prevention of opioid effects. used to reverse effects of opioids. MOA, drug blocks the receptor site equal opioid receptor cannot attach equal no opioid effects. Side effects: palpitation, shortness of breath, anxiety, diarrhea, thirst, urinary frequency.
Cardiovascular drugs. Cardiovascular system includes equal heart, arteries, capillaries, veins, and lymphatics. Goal: promotes oxygen plus nutrient delivery to cells and removal of metabolic waste. Types of drugs used to improve the cardiovascular system: inotropic, antiarrhythmic, antianginal, antihypertensive, diuretics, and antilipemic. Inotropic drugs. Inotrope equal increases force of heart contraction, positive inotrope. These drugs can prevent remodeling of L or R ventricle, common in heart failure. Cardiac glycosides. Positive inotrope, negative chronotrope, decreases heart rate. MOA inhibits Na-K-activated ATP equal increase in intracellular levels of Na and Ca equal increase in Ca will strengthen myocardial contraction. These drugs also act on CNS to increase vagal tone equal slowing of heart rate by slowing the Sa and AV nodes. Used for atrial fibrillation, controls the heart rate from being too fast, atrial flutter, heart failure, and supraventricular tachycardia. Side effects: abdo pain, confusion, vision changes, bradycardia, complete heart block. Herbals like St. John's wort and ginseng can increase digoxin levels equal increased risk of digoxin toxicity. Phosphodiesterase inhibitors. Used for short-term management of heart failure. MOA, PDI move Ca into cardiac cells equal improve cardiac output by strengthening contractions. Also, the drug relaxes smooth muscle equal less vascular resistance and less amount of blood returning to heart equal decreased afterload plus preload. Side effects: arrhythmias, headache, chest pain, hypokalemia, increase in heart rate, hypotension.